Welcome to All Things Chiropractic.
Welcome to another episode of All Things Chiropractic. I'm Paul Andrews.
And I'm Dr. Mark Davini. Welcome, everyone.
And we are super excited to have on our podcast today Dr. Bill Owens. Good morning, sir.
Hey, good morning, guys. Thank you so much for having me. I'm excited to be here.
We are too. So we always ask our guests this first question. How did you get into chiropractic? How did you become a chiropractor? What's the story?
How much time do we have?
We'll give you 2 minutes. Go ahead.
Yeah. Okay, all right. Good. I'll give you the Cliff Note version. I was always interested in healthcare in general. But to be honest, I think what really attracted me was the possibility of being on call and working in the doldrums of a hospital were not really a possibility. And the chances of encountering somebody with an infectious disease were pretty limited too. So, I was kind of looking more into the, sort of the holistic side, right? I had a lacrosse injury. Like, I feel like every chiropractor starts with this kind of story, but it's the truth. I was a center defenseman for lacrosse in high school, and I was undersized, but one day I just got run over. I got plowed into, they actually started the lacrosse program so the football players could get off season training.
Oh,
Right?
great.
Yeah. And
Yeah, that works.
and what it turned out, it was a thoracic rib. And, that mechanical aspect really resonated with me, that something that can be that painful can really just be purely mechanical. And that was sort of kind of the journey, that I went down.
Yeah. It's interesting what you said, and it's mostly it's generational, but
Yeah.
you'd be surprised. Over half the people in classes today in chiropractic colleges have never even been to a chiropractor before they went away to school.
Yeah,
So,
I
yeah,
think
that idea of us having it, I have had one, you had one, like you say, most of the people that are, we'll say, more than just out of school have experiences where chiropractic have saved their lives.
Yeah, and I think that, that origin story sometimes is important, but I also think as a profession, we have to also prepare for all of those other people that may not have had a personal experience, because otherwise,
Mhm.
how do we grow the profession, right? We can't just be a catcher's mitt for everybody that had a problem that was fixed.
Right, right, and that's kind of a lot of focus on many of our podcasts, where we're just trying to make the doctors aware that this is something that is great. It's wonderful. It helps a lot of people, and you can take it and move it to any place you wanna go. So that's why we have people like you on our podcast.
Well, that's, I like that because it's a pretty diverse profession, even in terms of how we practice, right? Which may be
Mm.
part of the reason why, there's a little bit of confusion out there because, we all kind of work a little bit differently.
So I have
And
to
we create
ask,
our own problems. Yeah,
Doc,
definitely.
I have to ask. So your clinical identity as a chiropractor, I'm going to guess it looks a lot different today than it did. But can you take us through sort of a trajectory of how you started your clinical, sort of who you were to who you are today?
Yeah, that's really sort of that's a great question. And I think that it's important to evolve, but we don't always reflect on that, right? And
Mm.
I think, for me back, I went to national, so I learned pretty much how to do everything but be a chiropractor, right? When I was in my, if
Oh,
I can say that
okay.
on the podcast.
Yes, you
Bill's
can.
address and phone number
Yeah.
is
But I will say, and I'm
You're
saying
being
that in a
honest.
very loving way because the diagnostic side was pretty heavy, and I enjoyed that, And when I got out, I practiced more in like a wellness holistic model, and I missed the diagnostic tools, right? Like I missed that complex patient. I missed the neurological deficits and the patient that, hey, that's not spine pain from a mechanical issue, that's a synovial cyst, or that's pancreatic cancer. So as I started kind of exploring that, I found myself just naturally hanging out with more MDs. And I think that was sort of the impetus for me to get to where I'm at now.
Okay, well, that probably begs the question, saying that for those who may not know everything about you, where are you now?
Yeah, I think, where I'm at is kind of smack dab in between the holistic model, um, on the most, say, maybe progressive side of chiropractic, and the medical model, which has very limited tools to address musculoskeletal mechanical pain, right? So I would say 85 to 90% of my practice now is direct referral from primary care physicians. And that's really where I believe chiropractic sits best, is in that intersection where primary care just fails. You know, and I've learned this over the years as I have a faculty position at the Jacobs School of Medicine up here in Buffalo, which is part of the State University of New York. So as I hung out with more med students, as I hung out with more family medicine docs, they're perfectly comfortable sharing their limitations. And, maybe that's just me being in an academic setting as opposed to like being in a competitive, down the street sort of, connection, because they're more willing to share that stuff.
That was an interesting comment you said about their deficiencies in a sense, and obviously from our perspective, maybe it's not uncommon for a chiropractor to feel as if they're the the one that's on the lesser end of the ladder, the lower end of the ladder. And what you're saying is that everybody has their thing, and their thing's their thing, and our thing's our thing, and we're both experts in what we do.
Yeah, I would agree with that wholeheartedly. And I think it's more of a testament to the complexity of the human body, right? We all appreciate that. I think if we were all to sit down, any healthcare provider, but I would say is that primary care doctors, when compared to most physicians, like surgeons or interventional docs or radiologists, they tend to get into medicine for the same reason we did,
Mm,
right? Like, lifestyle perhaps was part of it, but I would argue that most chiropractors get into it because they have a passion to help people. And I found that same like taproot mentality to be in family medicine as well.
interesting.
I think as you rise the ranks into specialty, that changes a little bit, but yeah, I found that to be really open. And honestly, I feel like the rate limiting step in all of it is most chiropractors aren't very good at talking about what we do to people that aren't patients.
So
Right.
true.
Communication is really huge. I wanna dive in a little bit to what you do beyond your particular practice, because we've had you teach. You did a nice seminar for us, and I want to explore a little bit about how you share what your successes were with other chiropractors.
Yeah, that's a good question. And I feel like, what I've realized over the years is that every chiropractor that's practicing is really at a different stage in their career. And I think learning how to interact with our communities is, it starts with education, right? Formal education. And then it sort of gets fed with experience. And then I think it ultimately gets honed with exposure, right? So we learn in chiropractic, so we get out in the community, we think we know everything, and then we kind of get our legs cut out from under us. And then we're spooked, right? But then as our experience grows, and then we get exposed to other healthcare providers and some of the larger systems, I think that's what builds us, right? So I think, like, for me, the best thing a chiropractor nowadays can really do is um, get some additional training in diagnostics, especially imaging. We can sit here and maybe have 50 more podcasts on the utilization of imaging. I'm passionate about that, um, especially advanced imaging like MRI, and get yourself out there. I go to more medical conferences than I do chiropractic conferences. Like, I want to sit in a room that with people that aren't doing what I do, right? Because I can learn from that. And the more medics that I hang out with, the more I have to explain what I do. And I think that exposure has really helped me. So my advice is always like, go to a pain management conference, sit next to a rheumatologist for a weekend and have a conversation about chiropractic and rheumatoid arthritis. Like there's opportunities everywhere.
Do you think that, in your experience, you mentioned the college you went to, and there's the colleges around the country, they have different flavors, right?
Mhm.
Do you find that the ones that are more philosophically based, let's say, do you find those doctors that you work with more challenging, or you come at them a little bit differently?
Yeah, that's a good question because I literally, I mean, that's the age old chiropractic question, right? Um, and to be honest, I think it matters. But what I have found is that the more philosophical based approach in the core education is actually a really important and a good thing because my background, I came from the opposite of that, right?
Right.
So it helped me to communicate with other professionals, but it didn't necessarily ground me day one into the chiropractic science, right? So I think whatever side we come from, if we even want to call it that, there's a deficiency that goes along with it. If I'm philosophical and I'm being trained in that manner, I'm probably outside of CCE guidelines, right? I'm probably a little deficient on the hardcore diagnostic side. And that's just because of a time component. There's only so much time, right? I think if I come from a diagnostic side because of time, I'm probably a little deficient on the philosophy. Now, which this is really going to get me on my soapbox. So thank you. Uh, I watched the same thing happen in medicine, right? The 4 years of medical school and the 4 years or 3 and a third years of chiropractic school. We've always talked about this, right? If you academically put them side by side, they're pretty similar. The difference is when that medical student graduates, they go to a 3 to 7 year residency program. And that's where all of the deficiencies that they had in medical school are fixed. And
Right.
we're just starting to come out of our shell with our profession, with VA and some of the other things that are going on.
There's no opportunity or very little opportunity. I'm sure you're a pioneer in this, breaking into the sort of the medical model and having chiropractors working alongside medicine in their setting, not in your setting. You know what I mean? And so one of the challenges, because I agree with you, wouldn't it be great if chiropractors had residencies and support outside of graduation or after graduation? Because what do, right? Dr. Davini and I talk about this all the time on our podcast. They end up going into solo practice, practicing in a silo, or they end up at a
Chief
at a
cook and
group.
bottle washer. Yeah.
Yeah, or they end up at a group practice that is really a pit mill that churns and burns their NPI, and then they fall away from the profession altogether.
And the other thing too is they're also having a difficulty, um, making it in practice today. So whatever the philosophies are or not, whatever is wherever you are in that continuum, people are finding it harder to make a living in this practice. And what I'm hearing from you, correct me if I'm wrong, is that we need to move in a direction that puts us into mainstream and help us become real.
Yeah, I wholeheartedly agree with that. It's where the patients are. But I'll always go back to this basic step. I mean, if you if a chiropractor is being treated like a subpar provider, right? It's probably because they're acting and communicating that way.
Mhm.
And when you elevate your own profession, see, and you said something that was really interesting. You said, not in our model or in our space, but in theirs, right? And, when I spend time at the med school, when I went through the Royal College training to become an attending, you know, um, what I learned was that we're working together. And that sounds like silly, right? And rah rah and happy go lucky. But the truth is, like, I had somebody that's a very close friend sent to me, Bill, when you hire somebody, you don't hire them to tell them what to do. you hire them so they can tell you what to do, right? They're filling a role, right? And when a chiropractor is working in a large system, or they're even in your community, you're working along MDs, they're looking for you to take a leadership role, right? Because if you're not going to take the leadership role, then they might as well use a therapist, right? So I think all of those tools are really, really important. And I feel like as a profession, we're like, when you're like in eighth or ninth grade, and then you have like family friends that have eighth or ninth graders and you watch them and all of a sudden you don't see them and they're a senior in high school and they're like, oh my gosh, dude, what happened to you? You're like an adult, right?
Yeah.
And it happens in a span, really a short span. That's what residency does. It puts you into a mess of patients and allows you 2 to 3 years to fight your way out of it. And when you come out of it, you're much stronger. And I think that's critical for us. Because
Well,
if we're just gonna have, sorry, if we're gonna have a profession that only embraces entrepreneurship, we're gonna have a problem.
if you could comment on, the Federation of Chiropractic Licensing Board does their study every 5 years, on the profession of chiropractic, and the most recent one stated that only 43% of chiropractors now have imaging in their office, X-ray, and
Yeah.
can you just comment on that? Because, we all have opinions about that, but here you are talking about advancing ourselves in our clinical competency, yet we seem to be going in a different direction as a profession.
Yeah, I would agree. I mean, imaging is our foundation, right? I mean, I would argue that the subluxation would have never been defined if it wasn't for radiography, right? Um, and I think, and I'm very close with the federation. They're doing really, really good work. I
Mm,
think centralizing governance is really, really important as we evolve. But you know, I use imaging virtually on uh, most, if not all, patients, and that's just kind of my style of practice because they tend to be injured to some degree. But I don't have X-ray in my practice. I refer out, right? I use a facility that
mm,
has everything in there, right? So I'd have really close partnerships with radiologists. So I would like to see them kind of evolve that a little bit more and to not just saying, because the assumption is if a doctor doesn't have X-ray in their facility, they're probably not using it. But my reasoning for not doing that is more business and reimbursement,
right.
because I'm in New York, right? It's going on every minute of every day. Um, but I think the fact, and then we can maybe get on a different topic, but the fact that we as a profession adopted imaging guidelines from an internal medicine society was fall off your chair moment, right? Like if we want to be the eighth grader becoming a senior, like we should be collaborating with medical specialty and orthopedics and neurosurgery, right? Look at their guidelines, right? I have neurosurgeons that won't even see a patient unless there's imaging, right? That's what they do, right? So,
There you go. Yeah.
yeah, I have a few feelings on that.
I do, and I feel like if you're going to talk intelligently with another professional, you have to be able to speak the language. You have to know your patient more than just saying, "Well, I did my thing. I got this little tricky thing I do with my hands, and they did or they did not respond." Instead of being able to say, "Look, I did this thorough exam. I have my imaging. I did this. I did that. What do you think is going on? Because this is what I think is going on."
Yeah, 100%. I think imaging is the great translator between all professions within healthcare, right? Like we can look at that image just like blood work would be, right?
Mm,
That's an objective evidence. This is the person's spine. Um, some of the hardest questions I think chiropractors have is when, a family medicine doc or maybe a neurologist comes and says, "Tell me what you do."
mm.
And then you're like, "Okay, well, I did this on this patient and they got better." And they're like, "Okay, well, show me what changed." Right? That's really difficult without a picture. Like, let's be honest.
Then it becomes symptom based, and that's it.
Yeah, and what's the purpose? I mean, you get more. We all know the statistics, right?
Mm.
I mean, in fact, we know now that a low dose of ionizing radiation is actually good for us.
Yeah, we had a whole podcast on hormesis.
Okay,
Yeah.
wonderful. Yeah, see, we're talking the same language,
Yeah, it's like,
And patients come in, they want to see what's going on inside.
So I think
Yeah.
you've said something that really intrigues a lot of doctors, and maybe you can guide us a little bit when you were saying that 85% of your practice comes from medical referral. So I know there are doctors out there thinking to themselves, how'd you do that? How did you get to that point where you were getting that many referrals from your local MDs?
Yeah, that terrific question. And I will tell you, it's not by marketing, right? It's
The free
not.
exam didn't do it, huh?
You mean you
No,
didn't buy
no.
lunch for the local medical groups every week, you know?
Yeah, and let's say continued connection and communication plays a role. But very simply put, the thing that most chiropractors do wrong is they talk about what they could do or what they can do as opposed to what they did,
Oh, I love
right?
that.
So if Paul, if you just sent me two patients, I could help them with XYZ. I could help them. I can help them, right? But what about all of the patients that I already have? What about all of those patients that, we have testimonials up on our wall? We have 3-ring binders in our reception area. Most of those patients have a primary care doctor. And most of those primary care doctors don't even know they're seeing us. And when you have somebody that failed therapy, they failed oral medication, they failed an injection, and they get better in our office, that's the poster child of how we should communicate, because what you're saying is, look what I did. Send me your sick, right?
Mm.
Send me your unresponsive. Send me the people that nobody else can help. And if I can help with them, then let's have a bigger conversation.
It seems to me that there's a lot of pieces that connect for exactly what you're saying, and I'll just rattle off a few for your opinion. Their communication skills have to be good with another medical professional, both in writing and orally. Their documentation of that visit has to be pretty good if they're gonna send that off or demonstrate what they did. Their staff has to be better at communicating with the other professionals or paraprofessionals that they might come, in contact with. And also, they have to be better at layman conversation with patients, but enough to show that there is an expertise versus a casual approach. Would you agree with that? And what are your thoughts?
Yeah, I think that's like the sort of the holy triad, right? Like that's the trinity of chiropractic educating medicine, right? Because we tend to, as a profession, and I'm saying globally, we tend to see other health professionals almost as an adversary, as opposed to somebody that just doesn't know what we do, right? And those three components, three pillars, right, are your front desk. You just mentioned that, right? Like, I want my front desk people to know their front desk people, right? Hey, Sue, it's Mandy from Dr. Owens' office. We have somebody here whose blood pressure is not really under control. Can we slide him in for a nurse's visit today? We're a little concerned. It's not bad enough to get him to the ED, and I don't want to wait for 4 hours, but can we get him over there? Like, as an example, right? So having that conduit, they know us, right? And, communicating about what we do, we could talk about that in a second. But that's really important. Like, what does your practice do? Why are they sending? Right? They're not sending for chiropractic care. They're sending for an assessment of the mechanical side of spine pain. But we can get to that. So your front desk, right? The second is in the documentation, which you brought up. I have reviewed tens of thousands of office visit notes from chiropractors, and they are riddled with listings and subluxation drawings. I mean, it looks like a nuclear physicist wrote it. But what they forget is they never put blood pressure or pulse or a past history in there. Now, we're trained to get all of that information, but it's typically written by the patient and stored in the chart. So if for some weird reason, a primary care doctor gets a hold of that note, they don't care about any of the chiropractic stuff. That's our job, right? But what they look at is, wow, they were administering a high velocity thrust to the cervical spine and they never really did a vascular exam. They didn't even take a blood pressure.
Don't get us started.
We just had a class on that also.
Yeah. So your note has to be standardized so they can trust, right? The currency in healthcare is trust. And if they look at that note and they don't trust you, that doesn't mean you're a bad chiropractor. What the medic believes is, hey, Bill is a good chiropractor, but he needs oversight because he didn't do A, B, C, D. That puts me in the category of a therapist. And if we go back to what I was saying earlier, if you're being treated like a therapist, then you're acting like one, right?
Mhm.
And then the third component, so we have our front desk, we have our documentation, and then we have the patient. Every single patient that comes into the practice, and you have a family personal doctor, you have a family doctor, yes. Do they know you're here? No. When do you see him again? Oh, in 2 months I have a physical. Great, tell them, right? We have an army of people in our practice that should be advocates. Yeah, I'm seeing Dr. Owens. Yeah, he's the one that's kept me back to work and kept working despite this disc herniation. I had a great patient last month. I mean, he had a 7 millimeter extruded L5S1 disc, and he's completely pain free back to work. Neurosurgeon said, I don't need to do surgery on him. That's a large disc problem.
Was he pissed you took that surgery away from him?
No, because actually that's a great point. No, because I found my niche. Like I work with the academic neurosurgeons, right? Which honestly follows more of a European model where it's not proprietary, right? Whether they do one surgery or they do 10 million, it doesn't matter in the academic setting. And that's just, I've been blessed to have that community here. So you can really work with the patient. But yeah, having your front desk communicate, having your documentation include all of your red flags, your yellow flags, your contraindications. I ruled all of this out. Now I'm going to adjust them is really money in the bank.
Well, Doc, we could be going on and on and on for about the next 10 hours, I believe. I've been in your class. I know you could easily do that and tell us everything we need to know, but maybe
Yeah.
in a summary statement before you tell us a little bit about your particular angle at business, maybe just sum it up to chiropractors listening to us right now.
Yeah, I would tell every single one of you to believe wholeheartedly that medical providers are genuinely curious. They're genuinely curious and they're typically natural born teachers, right? So, they've heard of chiropractic, but they've never seen one in the wild kind of thing, right? So they're curious.
Speak
Just
for
don't
it.
be a, don't be a jackass when you meet them,
Right.
right? Like ask them, tell me about what you do. What's your typical day like? What's a patient profile that you like to accept? Because inevitably what they're going to say is, yeah, tell me what you do. And when a chiropractor does that, and I've done it, you're going to fall flat on your face the first time. You're going to fall flat on your face the second time, and on and on and on and on until you get good at it. And I have not had any medical doctor ever criticize me for struggling. That's what their entire training is about, right? They want to learn and they want to see you evolve. The bad thing is when we hide because we're worried and we don't put ourselves out there and we don't struggle through 8th grade to get to the senior prom, right? And let those medical doctors ask you the questions that you don't know how to answer, because that's what's going to make you a better chiropractor, because that's what you do.
They say you miss 100% of the shots you don't take, right?
Wayne Gretzky.
100%. Yeah. And don't be afraid to struggle with it. I think it's important. Get yourself out there.
Nice.
So Doc, we've hosted one of your awesome sessions. You offer a lot to chiropractors. We've talked about how to elevate their game, but give us how you do that. Give us, basically doctors out there saying, well, I love all that Dr. Bill's saying and I want to know more. How?
Yeah. In terms of what I do or how I do it. Like,
In
meaning like
terms of somebody finishes this podcast but wants to know how to get a hold of you or find out more about how you can help them.
yeah, I've been in practice 28 years. About 15 years ago, I started helping practices to kind of build the practice that I have, which is very biomechanically oriented. I can do lots of different things. I just choose not to. very radiology centric, very adjusting centric, a couple modalities, and then everything gets referred out. That group has now evolved into the National Spine Management Group, which helps private practices, but also we're building a residency program, and I have a fellowship program for more training, right? So the idea is really just very simple. If you want to have more complex patients in your office, if you want to have those complex patients that are inherently and naturally wellness maintenance care, right? I have a lot of bad spines in my practice that are maintenance care patients. I've had them for decades. It's a really good model. Just find me on LinkedIn under National Spine Management, William Owens, and that's probably the easiest way to connect and just start a conversation, and
Love it.
get yourself out there. I'll help you to do that.
It's funny what you just said would resonate with a lot of doctors because the reliance on insurance reimbursement has dwindled immensely over the last, decade. And so having these maintenance, non-insurance reliant, income in your office is huge. And you're building it on both ends. So you're building the medical being a part of the medical process in your chiropractic practice, but also building the maintenance. So to me, as a non-chiropractor who does billing, I'm hearing it from both ends, which means, you're getting income from more than one bucket.
Well, 100%. I mean, honestly, medicine is staying away from managed care. The only reason medicine can survive in managed care is because they build a huge group and they negotiate, right? The
Mhm.
the mistake is us thinking that a primary care doctor actually has a fee schedule for Blue Cross and Blue Shield. No, their group has their own,
Right.
right? So even they know that. And one great environment to really dive into is the concierge medicine folks, right? Most of them don't have a musculoskeletal answer, and they have practices filled with people paying cash, right? They just need a MSK musculoskeletal partner that can figure out the biomechanics of the spine and help people. So again, it goes all the way back. Like, just do a good job, right? Don't try to be everything. Just be a damn good chiropractor and be able to explain it. Now, that's easier said than done. That's like traveling up the mountain to the Zenful Kung Fu master in the distance, where they move a lot less than the new
Yeah.
student that's exhausting themselves, right?
Love it.
But that
Love
evolution
it.
is important.
I'm picturing that guy on the mountain with a spine in his hand and an activator in his hip pocket, and
Listen, I daydream about that all day, right? Like, who are
Zen
those
robes.
people, and
I love it.
um,
Oh,
yeah, like you need to get out there and learn more from health providers that don't know what you do. Because a patient's never going to ask you that really boring, like, and I'm saying boring, not in being bored, but the one that really digs in and hits you right in the brainstem. They're not going to ask you that question, but an MD is, because they have enough knowledge of MSK to be dangerous. I was just at the medical school about 10 months ago, and they spend 1 day in gross anatomy on spine. 1 day.
Wow.
I had a friend that told me when they got to feet, they told us that you have two. Move on.
Yeah, 100%. Because nobody can be taught everything.
Right.
So,
That's why.
do you remember the movie Forrest Gump when they were in Vietnam and him and Bubba were sitting there and he's like, "Hey, Forrest, how about we lean up against each other so neither of us have to sleep with our face in the mud?"
Yeah. There you go.
The same thing. It's the same thing. I rely on that primary to handle all that lab and blood work. Dude, your blood pressure is out of control. You got double vision. Like, you need to get stabilized. But hey, your pelvic incidence is off. You do have a loss of lordosis in your cervical spine. I can help with that. Now we're a team.
Cool. Very
Awesome.
nice. Thank you.
Well, we could go all day, but have run out of time, Dr. Owens. But we so appreciate you taking the time. And for those that are hearing this conversation and saying, I want this. I want more help. I want to elevate my game. Just go on LinkedIn and look for Dr. William Owens. And if you are having a hard time, you can always reach out to us through allthingschiropractic.com. Send us a message. We'll get you connected up with Dr. Owens. And again, Doc, thank you so much for taking the time. And it's always been awesome to see see what you did in the seminars we did, and also to just hear your perspective. It's really important, I think, for the chiropractors out there.
Great
Yeah,
talking with you.
there's just so much to talk about. So if you guys ever do an All Things Chiropractic weekend where we just talk for 48 hours, I'm
Oh
good.
yeah. Oh, there you go.
I
Like
know you will
straight,
be.
no
That'll be
breaks.
yeah, I'll
No
be
breaks.
there.
No breaks.
I'll be
Because
there.
listen,
Yes,
once you get delirious, that's when
Yeah.
the real fun stuff
Yeah.
comes out.
that's right.
We'll have to put those piddle pads on that pilots wear, you know?
There you go.
Oh,
100%.
nice. Hey, thank you. We
All
appreciate
right.
you being here.
Yeah.
All right. Thanks, guys. Love seeing you.
Thanks again for listening to All Things Chiropractic. I'm Paul Andrews.
I'm Dr. Mark Davini and Dr. William Owens. Hey.
Thanks for listening to All Things Chiropractic. We'd love to hear from you. Visit allthingschiropractic.com with comments, episode ideas, or questions. Or connect with us on Facebook and Instagram at All Things Chiropractic Podcast. Be sure to join Dr. Mark Davini and Paul Andrews next time for another episode of All Things Chiropractic.